Okay, good evening, bachon. So, am I visible? I can see that yes, I am visible. But am I audible to you all? Great. Chalo. So, if I am audible also, then in that case, let's start the important topic which I told you that we are going to start, and that is antepartum hemorrhage, the basics of placenta previa. Now, before I go into what are the basics of placenta previa, first thing which you need to know is what is antepartum hemorrhage. So, please remember any bleeding which is occurring from the genital tract or any bleeding which is occurring into the genital tract, right, beyond the period of gestation. And period of gestation in India is taken as 28 weeks. So any bleeding which is happening at more than equal to 28 weeks of pregnancy and it is happening until the delivery of the placenta, right? So any bleeding beyond 28 weeks of pregnancy and up till the delivery of placenta, that is what is called as antepartum hemorrhage. A very important single liner question is that what is the most common cause of antepartum hemorrhage? Please remember that the most common cause of antepartum hemorrhage is abruptio placenta, right? What is the second most common cause of antepartum hemorrhage? Second most common cause is placenta previa. Don't say it the other way around. Most common cause is abruptio placenta. Good evening to all of you, right? Now, other cause which you have to know is vasa previa. Vasa previa can also lead to antepartum hemorrhage, right? So these are the causes. Other than that, a circumvallate placenta also can lead to antepartum hemorrhage, right? What is a circumvallate placenta? I'll tell you when we are doing important images. Okay? So these are all the causes of antepartum hemorrhage, in which the most common being abruptio, second most common being placenta previa. In other causes, you have to remember vasa previa and you have to remember circumvallate placenta, right? Okay. Now, जब भी question आएगा on antepartum hemorrhage and your question says that there is a patient who has come to you with bleeding at or more than 28 weeks. तो most of the times आपको ना बताते नहीं है. In your questions they are not going to tell you कि ये placenta previa का patient है या ये abruptio का है या ये vasa previa का है. From the history of the patient, from the presentation of the patient, right, from the examination findings, you have to come to a conclusion कि आप placenta previa से deal कर रहे हो कि abruptio से deal कर रहे हो. And these are the types of questions which are being repeatedly asked these days, right? So अगर आपके पास patient bleeding के साथ आ रही है and there is no pain in abdomen, so patient is coming to you with bleeding and there is no pain in abdomen. Bleeding का color अगर दिया होगा तो it will be given as bright red in color, right? And ये जो bleeding होगी ये causeless होगी. मतलब causeless का मतलब there is no reason for bleeding. Most of the times patient is going to say कि वो सो रही थी. She was sleeping when she started having pain, right? When she started having bleeding. Then number 2, bleeding is going to be recurrent. रिकरेंट का क्या मतलब हुआ? रिकरेंट का मतलब ये हुआ कि पेशेंट हिस्ट्री देगी दैट 3 days बैक भी उसको ब्लीडिंग हुई थी, देन द ब्लीडिंग स्टॉप्ड एंड आज फिर से ब्लीडिंग हो रही है. तो इस तरीके की हिस्ट्री की, इनिशियली पेशेंट हैड ब्लीडिंग, देन द ब्लीडिंग स्टॉप्ड एंड अगेन शी इज हैविंग ब्लीडिंग. दिस इज द काइंड ऑफ हिस्ट्री व्हिच यू गेट इन केस ऑफ placenta previa. Third very important thing, third very important symptom which you get is warning hemorrhage. characteristic of bleeding is warning hemorrhage is there. What do you mean by warning? Warning means पहले से कोई हमें warn कर रहा है. Same thing happens in patients with placenta previa. In patients of placenta previa, there is initially less bleeding. Initially there will be less bleeding and this will be followed by heavy bleeding. And ये जो initially less bleeding होती है उसको कहते हैं warning hemorrhage, right? So if your question is saying that patient को bleeding हो रही थी but there was no pain in abdomen, ऐसी हिस्ट्री दे रहा है पेशेंट की डॉक्टर साहब 3 days back I had bleeding and again फिर bleeding stop हो गई थी and now again the bleeding has started, right? And जो 3 days back bleeding हुई थी that was less in amount but now the bleeding is very heavy. This means that you are dealing with a case of placenta previa, right? On the other hand, if your patient is complaining of bleeding and along with bleeding there is pain in abdomen, pain in abdomen is present, right? Bleeding ka color is dark red, right? And आपका question कह रहा है that there is a reason for bleeding. That reason could be कि there is history of trauma. तो क्वेश्चन कह रहा है कि पेशेंट का कार एक्सीडेंट हुआ या she fell down or she was hit by someone, right? या if there is history of PIH, patient has history of high BP, right? Then this means that this raises the suspicion of abruptio placenta. Number 2, in case of abruptio, bleeding is never recurrent. What do you understand by this term? कि bleeding is never recurrent. इसका मतलब ये होता है कि जब भी abruptio होता है, abruptio means when I'll do abruptio, I'll tell you that abruptio का मतलब होता है that the placenta has started separating before the delivery of the baby, right? And जब भी placenta starts separating before the delivery of the baby, ये प्लेसेंटा पूरा का पूरा सेपरेट होता है एंड पेशेंट गोज इनटू लेबर. तो कभी भी ऐसी हिस्ट्री नहीं मिलेगी कि 3 दिन पहले ब्लीडिंग हुई थी देन द ब्लीडिंग स्टॉप्ड एंड अगेन आई एम हैविंग ब्लीडिंग. एक बार ब्लीडिंग स्टार्ट हुई इन अ पेशेंट ऑफ एब्रप्शियो प्लेसेंटा, इट एंड्स इन डिलीवरी, right? So you never get a history that 4 days back I was having bleeding and then the bleeding stopped and now again I'm having bleeding. This kind of history you never get in a patient of abruptio. There is no warning hemorrhage, right? So if you are getting this kind of history, you should suspect abruptio. If you were getting pehle wali history, you should suspect placenta previa. Not only this, on per abdominal examination also, in case of placenta previa, you will have different kind of findings. In case of abruptio, you will have different kind of findings. In case of placenta previa, on per abdominal examination, uterus is soft, it is non-tender, right? Uterus is soft, it is non-tender. Fetal heart sounds are easily heard, right? And height of the uterus is equal to period of gestation, right? Whereas in case of abruptio, on per abdominal examination, uterus is tensed, it is tender, it is rigid, right? And जब uterus tensed होगा, tender होगा, rigid होगा, so common sense tells me that fetal heart sounds are not easily heard, right? And height of the uterus is more than the period of gestation in case of abruptio, right? So these are the findings, per abdominal findings, which tell you that you are dealing with abruptio. Now, what happens in vasa previa? In vasa previa, there is velamentous insertion of cord. There is velamentous insertion of cord. What is this velamentous insertion of cord? So suppose this over here is the abdomen, mother's abdomen. This is the uterus. These are fetal membranes. Fetal membranes कौन सी होती हैं? Amnion and chorion. अंदर वाली amnion, बाहर वाली chorion. This over here is placenta, right? And this is the fetus. This over here is amniotic fluid. And suppose the cord of the baby is first attached to the membranes and then it goes and attaches to the placenta like this. So cord is attached to the membranes first. So अब बताओ, if the cord is attached to the membranes, जब भी membranes rupture होंगी, the cord is going to get ruptured, right? So when the membranes rupture, the cord ruptures. And all of us know that cord has got umbilical artery, umbilical vein, right? So the vessel, the fetal blood vessels get damaged. Fetal blood vessels are damaged and this leads to fetal blood loss, right? This leads to fetal blood loss. Placenta previa में mother का blood loss हो रहा था. In case of vasa previa, it is the fetus who will lose blood. So in placenta previa will lead to maternal mortality. Vasa previa is going to lead to fetal mortality. In other words, perinatal mortality. मतलब it is going to lead to the baby की mortality होगी. इसमें mother को कुछ नहीं होगा in case of vasa previa. लेकिन because ये blood mother की vagina से निकलेगा, so obviously we are going to include it in antepartum hemorrhage. So in case of vasa previa, you will see that patient question ये कहेगा कि patient को bleeding बहुत कम हो रही थी, right? The patient was having less bleeding, but the fetal distress is more. Fetal distress is more. There is no pain in abdomen. Mother को कोई pain वेन नहीं होगा, right? So there is less bleeding, there is no pain in abdomen. Because there is no pain in abdomen, that is why इसकी differential diagnosis क्या होती है? Placenta previa, right? तो patient को बहुत कम bleeding हुई and पेन नहीं हुआ abdomen में, लेकिन इस less bleeding के comparison में जो fetal distress हुआ वो बहुत ज्यादा हुआ. In comparison to placenta previa में you get very less fetal distress, right? जब बहुत ज्यादा bleeding होगी तब fetal distress होगा in case of placenta previa. But in case of vasa previa bleeding कम होगी, लेकिन question ये बताएगा कि there is fetal distress. तो अगर ऐसी कुछ history मिल रही है, then it means you are dealing with vasa previa. या number 2, अगर आपका क्वेश्चन कह रहा है कि fetal distress occurs after the rupture of membranes. So once there was a question which had come which said that your patient is in labor, she is at 36 weeks of pregnancy, she is in labor and labor was progressing normally. उसके बाद when the membranes were ruptured, she had bleeding and there was a lot of fetal distress immediately after rupture of membranes and her ultrasound was normal. Ultrasound normal का मतलब placenta previa नहीं है. And क्योंकि question is saying कि membranes rupture हुई and then you are getting fetal distress, that means it is a case of vasa previa. Please remember this point very this is a very important point, that if bleeding is happening after the rupture of membranes, it means you are dealing with vasa previa and bleeding less होगी, fetal distress बहुत ज़्यादा होगा. In placenta previa बहुत ज़्यादा bleeding होगी तब fetal distress मिलेगा. vasa previa में less bleeding होगी लेकिन fetal distress बहुत ज़्यादा होगा क्योंकि this blood belongs to the fetus, right? Clear to all of you? So, on the basis of history and per-abdominal examination findings, we can come to know whether we are dealing with placenta previa, abruptio or vasa previa. Now, quickly let us talk about placenta previa. Where is the placenta located in case of placenta previa? It is located in lower uterine segment. Where is the placenta located? It is located in lower uterine segment. Now, एक older classification है placenta previa का, and now there is a new classification for placenta previa. You have to know both of them. According to new classification, if the edge of the placenta, it lies within 2 centimeters of the os, but doesn't touch it, that means it is a low-lying placenta. Low-lying placenta का क्या मतलब हो गया? That means edge of the placenta, it lies within 2 centimeters of the os, but it doesn't touch it. If the placenta touches the internal os, or covers it, right, then that is what is called as placenta previa. So there are only two terms used these days. One is placenta previa and the other is low-lying placenta, right? Older classification के according, जो आपका low-lying placenta था, that was type 1 placenta previa. Low-lying was type 1 placenta previa. It was also called as lateral placenta previa. Lateral placenta previa. Then if the placenta touches the internal os but doesn't cover it, if the placenta touches the internal os or reaches up till the margins of internal os, right? So it reaches up till the margins of internal os but doesn't cover it, right? Then that is what is called as type 2 placenta previa. Type 2 placenta previa को marginal placenta previa भी कहते हैं, right? Then we have the third type of placenta where the placenta covers the internal os partially. So placenta covers the internal os partially. This is what is incomplete placenta previa. Incomplete placenta previa. This is also called as type 3 placenta previa. And if the placenta covers the internal os completely, right? So placenta is covering the internal os completely, then that is what is type 4 placenta previa, which is also called as a complete placenta previa or central placenta previa, right? So this classification is very, very important for all of you. Next, very important one-liner which I want all of you to remember is, these are not important points nowadays, इनकी कोई significance नहीं है, but अगर कोई पुराना question आ जाए, so you should know this. Stall-worthy sign. Stall-worthy sign is seen in posterior variety of placenta previa. Stall-worthy sign is seen in posterior varieties of placenta previa, right? Now, in patients in whom placenta is in lower uterine segment in first trimester, T1 is first trimester, in 90% cases in third trimester, placenta migrates up and it reaches the upper uterine segment. Right, 90% cases में जब आप repeat ultrasound करोगे in third trimester, placenta will migrate up and it will reach the upper uterine segment. So I'm writing just migrates properly so that you don't confuse what have I written. So this is migrates. So placenta migrates to the upper uterine segment. So now placenta is in upper uterine segment in 90% cases. In 10% cases in third trimester, placenta remains in lower uterine segment, and ये 10% cases are placenta previa के patients. In these cases, placenta previa is confirmed. राइट ये जो 90% केसेस हैं जिसमें प्लासेंटा माइग्रेट कर जाता है वो प्लासेंटा प्रिविया नहीं रहता है. दैट इन देम द प्लासेंटा कम्स इन द अपर यूट्राइन सेगमेंट. 10% केसेस में इन थर्ड ट्राइमेस्टर प्लासेंटा रिमेन्स इन लोअर यूट्राइन सेगमेंट एंड दैट इज हाउ प्लासेंटा प्रिविया इज कंफर्म्ड. ओनली 10% केसेस में. सो इफ आई आस्क यू व्हाट इज द बेस्ट टाइम to do ultrasound to diagnose placenta previa, what is the best time to do ultrasound? Best time to do ultrasound is third trimester. 32 weeks पे करते हैं and then 36 weeks पे करते हैं. Now this is please very very important in many of your questions जो antepartum hemorrhage के आते हैं. Question tells you कि 32 वीक्स पे अल्ट्रासाउंड हुआ एंड एवरीथिंग वाज नॉर्मल. सो अब 32 वीक्स पे अल्ट्रासाउंड हुआ एंड एवरीथिंग इज नॉर्मल एंड पेशेंट हैज कम टू यू विद ब्लीडिंग. कैन शी एवर बी अ केस ऑफ प्लेसेंटा प्रिविया? नो, क्योंकि अगर 32 वीक्स पे नॉर्मल है तो दैट मीन्स शी इज नॉट अ केस ऑफ प्लेसेंटा प्रिविया. 32 वीक्स पे अगर लोअर यूट्राइन सेगमेंट में दिख रहा है प्लेसेंटा, देन ओनली शी इज अ केस ऑफ प्लेसेंटा प्रिविया. Is that clear to you? So read your questions very carefully. Many times they say कि 32 weeks पे ultrasound किया and ultrasound was normal. That means your patient is not a case of placenta previa. ऐसा कभी भी नहीं होगा कि 32 weeks पे placenta upper uterine segment में दिख रहा है and then 36 weeks पे फिर नीचे आ जाए. ऐसा नहीं होता. This never happens. Right? Okay. What is the screening ultrasound for placenta previa? So screening ultrasound for placenta previa is transabdominal ultrasound. So कभी भी अगर आपका क्वेश्चन आएगा that there is a case of antepartum hemorrhage, right? And patient के vitals stable हैं और क्वेश्चन में ना पता नहीं लग रहा है कि ये एब्रप्शियो का पेशेंट है कि प्लेसेंटा प्रिविया का पेशेंट है. कोई अल्ट्रासाउंड मेंशन नहीं किया, कुछ नहीं किया. दे हैव सिंपली गिवन यू दैट देयर इज अ केस ऑफ एंटीपार्टम हेमरेज जिसके वाइटल स्टेबल है एंड दे आर आस्किंग यू व्हाट इज द नेक्स्ट स्टेप. So the next step becomes total abdominal ultrasound because that is a screening ultrasound. टोटल अब्डोमिनल अल्ट्रासाउंड करके देखेंगे, अब्डोमिनल अल्ट्रासाउंड करके देखेंगे. टोटल अब्डोमिनल अल्ट्रासाउंड नहीं कहते, दिस इज ट्रांस अब्डोमिनल अल्ट्रासाउंड, ट्रांस अब्डोमिनल सोनोग्राफी. सॉरी, it is not total abdominal ultrasound, it's trans abdominal sonography. So when you have a patient of antepartum hemorrhage and the vitals of your patient are stable and they ask you what is the next step, next step is trans abdominal sonography. Right? Don't directly go to the investigation of choice. You have to start from screening ultrasound. The investigation of choice for placenta previa is TVS. Very, very important that per vaginal examination and per speculum examination are contraindicated in placenta previa patients. But the investigation of choice is TVS. Clear to all of you? Yes, but please remember the screening ultrasound is total abdominal trans abdominal sonography. Right? TEH say I'm just now I was teaching someone cancer cervix. So okay. So trans abdominal sonography. Right? Okay. Now comes a few important things which we've already done, but I want you to remember again. Bleeding in placenta previa is described as painless, causeless, recurrent bleeding. Painless, causeless, recurrent bleeding, and warning hemorrhage is present. Painless, causeless, recurrent bleeding where warning hemorrhage is present. Clear? Okay. On per abdominal examination, what do you get? On per abdominal examination, you are going to get uterus is soft, uterus is non-tender, right? Height of the uterus is equal to the period of gestation. Fetal heart sounds are normal and they are easily heard. Fetal parts are easily felt. Fetal parts are easily felt. Right? Now, complication of placenta previa is malpresentations. Malpresentations are common in placenta previa, most common being transverse lie followed by breach. The most common malpresentation is transverse lie. Common sense tells me कि अगर uterus ऐसा है and placenta is in the lower part of the uterus like this in case of placenta previa, तो obviously maximum space बचता है like this. So the most common malpresentation which you get is transverse lie followed by breach, right? What is not a complication? DIC. DIC is a complication of abruptio. It is not a complication of placenta previa, right? Then, are you going to do a per vaginal examination? Are you going to do after per abdominal examination? Will you do a per vaginal examination? No. Per vaginal examination is contraindicated. Per speculum examination is contraindicated. What are you going to do? First, you are the investigations which you are going to do. First, you will do a trans abdominal scan and then it will be followed by TVS, which is the investigation of choice. Right? So, this is the basic which I wanted to tell you about placenta previa. Management of placenta previa, the Chota Packet class will happen tomorrow and I will deal with you the management of placenta previa. But placenta previa and abruptio are very, very important. Another thing which is very important in case of placenta previa is the risk factors for placenta previa. Risk factors for placenta previa. Now, remember, पूरी OBS में there are 4 conditions जिसके risk factors पे direct questions आते हैं. Placenta previa, abruptio, then postpartum hemorrhage, you get direct questions and you get direct questions placenta accreta के भी risk factors पे and PIH. Right? Placenta accreta की 2 ही हैं, so that is why I don't count it in those 4 conditions. So, PIH, placenta previa, abruptio and PPH. Direct questions are asked from risk factors. Similarly, gynae में risk factors में cancer cervix के risk factors are important. Endometrial cancer के risk factors are very, very important. Right? So, these days they have also started asking risk factors for vulval cancers. Right? So, risk factors for placenta previa में 3 categories याद रखनी है. Number 1, if there is history of previous placenta previa. So, if there is previous history of placenta previa, that has got maximum risk. Maximum risk. Right? Then, if there is a big placenta. If there is a big placenta, right? Whenever there is a big placenta, a part of the placenta can also be situated in the lower uterine segment. तो big placenta कब मिलता है? Suppose there is succinturate lobe, right? या twin pregnancy. You are going to get big placenta, right? Or if there is anything, any factor which prevents migration of the placenta. So I was telling you in 90% cases placenta ऊपर चला जाएगा. So anything which is stopping the migration of the placenta, and what is that anything? That anything could be additions. For example, if there is previous history of cesarean section, or if there is previous history of dilatation and curettage, if there is previous history of myomectomy, or if your patient is a smoker. Why a smoker? Because जब वो smoke करेगा, it is going to lead to endometritis. Endometritis. So endometritis in itself is also a risk factor, right? Then please remember, increased maternal age and increased maternal parity, which means कि placenta previa is more common in multiparous females. On the other hand, I want all of you to remember, PIH is more common in primigravida. So PIH is more common in primigravida, whereas your placenta previa is more common in multiparous females. Similarly, abruptio. In other words, जितने भी antepartum hemorrhage के patients होते हैं, antepartum hemorrhage is more common in multiparous females. Clear to all of you? Yes? So, I hope all of you have understood. Priyesh Nagar, yes, marrow rapid revision is enough. That's not a rapid revision, basically that's revision, and revision is enough for FMGE, right? Then 5 accelerations are seen for 15 seconds on 3. Obviously, if you are getting 2 or more than 2 accelerations, Gopi Kishore, if you are getting 2 or more than 2 accelerations in a period of 20 minutes, that means that NST is reactive. Then comes nursing officer aims NORCET के लिए crash course कब launch होगा? It will be launched very soon. Very soon it will be launched. DK, ma'am, are you coming to Mumbai in DBMCI in July? It's not in July, it's in August, beta. Yes, it's in August and I am coming to Mumbai. Then, any other question related to academics? Any other question which you have? Okay, so this is what you had to remember in placenta previa. That's all for today. So see you tomorrow with the management of placenta previa. Take care, all the best, keep studying.